Even though Canada is recognized as a world leader in resettlement, our own history has sadly been tainted by injustices that have been visited upon those seeking safe harbor in Canada. We must always reflect on these lessons of history and ask ourselves, can we do better? Today offers us such an opportunity, for we are here to acknowledge an exceptional group of asylum seekers, many of whom live right here in Montreal.
These people are themselves vulnerable because of their past, but they were ready to put their own health and safety in peril in order to save the lives of others. These are the people who showed up hour after hour, day after day, month after month, in order to work in hospitals and the long-term care homes and retirement homes, which is where COVID-19 hit and struck most grievously. And it is these people who supported and sustained our healthcare workers and chose of contributing by helping the elderly, the sick, and those fighting for their lives since the beginning of the pandemic.
They put themselves at risk, and we are grateful for their service, for their sacrifice, and for their instinct to put the needs of community ahead of all else. I know we will remember their courage and compassion for years to come. As these individuals face an uncertain future in Canada, the current circumstances merit exceptional measures in recognition of their exceptional service during the pandemic. So today, we are introducing a one-time measure that will provide a specific pathway to permanent residence for asylum claimants working in Canada's healthcare sector in recognition of their exceptional contribution during the COVID-19 pandemic.
Since these people are faced with uncertainty in the future of Canada, the present circumstances merit exceptional measures, recognizing their exceptional services during this pandemic. Consequently, today, we are introducing a special measure that will offer a specific pathway towards permanent residency to asylum seekers working in the healthcare sector in Canada as a recognition of their exceptional contribution during the pandemic. The admissible people for an examination within this temporary program are asylum seekers, including those whose claim is still being worked on, those people who work in the healthcare sector and who live in Canada. And in order to be eligible, individuals must have asked for asylum before the 13th of March 2020. They must have received a work permit after, and they must have worked in a designated profession in the healthcare sector. For example, orderlies, nurses, attendants, people associate and patient attendants. They must have worked in a profession designated as such for at least 120 hours between the 13th of March 2020 and today, the 14th of August 2020. They must show 6 months of experience in the designated profession. And finally, the candidates must have a Quebec selection certificate if the claim is for Quebec.
For consideration under this temporary program are asylum claimants, including failed claimants, and those with pending claims working in the healthcare sector and their family members who are living in Canada. In addition, in order to be eligible, individuals must have claimed asylum before March 13, 2020, must have been issued a work permit after they made a claim for asylum, must have worked in a designated occupation in healthcare, must have worked in a designated occupation for no less than 120 hours between March 13, 2020 and today, August 14, 2020, must demonstrate 6 months of experience in the designated occupation. And finally, applicants must have a Quebec selection certificate if they are applying for eligibility in Quebec.